Huge news in the psychedelic medicine world. Pharmaceutical giant Eli Lilly just announced it's acquiring AtaiBeckley in a deal worth $2.8 billion upfront with the potential to reach $3.8 billion in the future. That's billions with a B. That's a huge number and probably the biggest investment we've ever seen in the psychedelic medicine space. So what is Lilly actually buying? Well, the biggest prize is BPL-003, Atai's experimental nasal spray based on 5-MeO DMT that's being developed to help people with treatment-resistant depression. Now, this therapy is designed to restore neural connections, to help the brain heal in a much different way than traditional antidepressants. It's already received the FDA's breakthrough therapy designation, and they hope to complete phase 3 trials in a few years. Now, AtaiBeckley is also developing a few other medicines, including a DMT-based treatment and an MDMA-derived therapy for psychiatric disorders. Now, these programs are still experimental, but together they represent the most advanced pipeline in psychedelic medicines today. What's really, truly fascinating, though, is that while these compounds may sound new, they're part of a much older human history that goes back thousands of years. I mean, my own Taino ancestors from the Caribbean, my Puerto Rican and Dominican and Cuban ancestors, they practiced sacred cohoba ceremonies long before Western medicine existed. During these ceremonies, the spiritual leaders, the shaman, the bohique, they would inhale a snuff made from seeds from a tree as part of their ritual. And they would use these to commune with the spiritual world. And now, of course, these medicines aren't identical to the pharmaceutical medicines coming out of these companies today, but the compounds are very, very similar, and they work on the brain in a very, very similar way. And it's remarkable to see one of the world's largest pharmaceutical companies investing billions of dollars in medicines that the earth gives to us for free, that people have been practicing for thousands of years. Now, whether these therapies ultimately prove safe and effective will determine how well they get into the hands of everyday people. But one thing is becoming increasingly clear, that psychedelic medicine has moved from fringe hippie culture to boardrooms to big pharma, and that may be one of the biggest mental health stories of this decade and of many, many decades to come.